Hi, welcome to Pregnancy. We're glad that you're here today to join us for our first trimester prenatal class. From the time you find out that you're pregnant, your body has already started making several changes. Conception typically occurs around day 14, although this can vary from woman to woman depending on what days they ovulate and how long their cycles are. Conception occurs when the sperm and the egg join together. After this, the cells start rapidly dividing. The bundle of cells travels down the fallopian tube and implants into the uterus. Typically, by the time you can get a positive pregnancy test, which are most commonly urine test, but can be blood tests as well, then you're about 4 weeks pregnant. The first trimester lasts through the 13th week. As you can see in the picture, it shows the conception starting as just 2 cells, and that by the 12th and 13th week, there's so many parts of your baby that's already been formed. Whether you've recently found out that you are pregnant, as a support person, or just here to learn more about the first trimester of pregnancy, we're glad that you're here. Today, the class objectives are as follows. We want to talk about the overview of the first trimester, which I've already touched on some. Discuss nutrition in pregnancy, appropriate weight gain in pregnancy, exercise, common symptoms including nausea and vomiting, things you should avoid now that you're pregnant, and when to call your doctor. The first trimester starts actually at the last menstrual period. So the period you have before you get pregnant is considered when the first trimester starts. It lasts throughout week 13, and like I had mentioned before, there are several changes that undergo during this time. During ovulation, a woman's ovary releases an egg, and the sperm meets the egg, and that's called fertilization. This occurs in the fallopian tube. As the cells divide, the bundle of cells travels down the fallopian tube and implants on the inside of the uterus. The uterus is the organ that houses the pregnancy. As you can see in the picture, it shows from week 1 all the way to week 9 some of the changes that the embryo is undertaking. Between 5 and 6 weeks, the embryo's heart will start to beat. One of the first signs of pregnancy, and is considered the cardinal sign of pregnancy, is a missed period. So if a woman of childbearing age has not had her expected period for about a week, then one of the first things that's recommended is pregnancy testing. Nutrition in pregnancy is extremely important. It's not only important to eat healthy to help you maintain a healthy weight and avoid excessive weight gain during pregnancy, which helps keep you at lower risk for medical problems associated with pregnancy. It's also very important for your growing infant to get all the building blocks it needs for organ development and to be able to grow. The picture shows different categories of foods that should be in your daily diet ideally. Fruits and vegetables are going to be extremely important. These provide high levels of vitamins that are good for your developing baby. It is also important to include protein, some grain, and dairy in your diet. We recommend avoiding excessive processed foods and sugary foods that have little nutritional value. During pregnancy, it's also important to avoid some types of foods because of potential risk. We'll talk more about that at an upcoming slide, but some of the important things to avoid during pregnancy are soft cheeses that are unpasteurized, unpasteurized milk, any kind of meat that's raw egg, and then hot dogs, luncheon meat, and other deli meats should be heated before eating them. The reason for this is because these foods contain a risk for bacteria that might not affect you but could affect your baby. It is recommended that all women of childbearing age take a prenatal vitamin. This is because from the very start of pregnancy, it is important for certain vitamin levels to be normal to prevent birth defects such as spina bifida. Folic acid is very important. It is also recommended to have 15 to 30 milligrams of iron daily in your vitamin because iron deficiency anemia is extremely common in pregnancy. This is because your body's working hard to increase red blood cells to provide your uterus, placenta, and baby with the appropriate nutrition. The recommended daily dose of folic acid is 0.4 to 0.8 milligrams for the average woman. Folic acid and iron are included in most prenatal vitamins, but it is important to check the label. Another vitamin that is recommended during pregnancy is vitamin D. This is something that you could talk to your doctor about, and it is available over the counter. Recommended daily dose during pregnancy of vitamin D is 2,000 to 4,000 international units daily. If you're eating a high fruit and vegetable diet, you would be getting likely the necessary amounts of folic acid, potentially iron, and potentially vitamin D just in your diet. However, because everybody's diet varies tremendously, it is recommended to take the prenatal vitamin. If iron isn't well tolerated, you could take a prenatal vitamin without iron and try to take iron separately just 3 times a week so you don't have to take it every day. Upset stomach is common by side effect of iron. Ferrous sulfate is a common over-the-counter iron supplementation that you could get and take separately. Lots of women ask about the prenatal vitamin gummies. It is important to check the label on the gummies because it is common for that formulary to not necessarily have all the recommended values. Next, we're going to talk about appropriate weight gain during pregnancy. How much weight gain that's recommended during your pregnancy depends on your pre-pregnancy weight. For example, if you were underweight, which is considered a BMI less than 18.5, then it is recommended to gain 28 to 40 pounds. This is considered healthy and an appropriate amount of weight. If you are obese, which is defined as a BMI of greater than or equal to 30, it is recommended that less total weight gain during pregnancy. The recommended weight gain for obese women is 11 to 20 pounds. This is to help prevent excessive weight gain, which can increase pregnancy-associated diseases like preeclampsia and gestational diabetes. We never recommend that women go on strict restrictive diets during pregnancy. We want you to focus on a healthy diet and healthy activity levels to prevent unnecessary weight gain that puts you at increased risk. It's a common misconception that during pregnancy you're eating for two. However, caloric intake needs in pregnancy really only occur in the second trimester and are definitely not double of the total recommended daily calories that you should be getting. At your prenatal visits, your OB provider will be monitoring your weight gain, and this is something that you should talk to them about if you are worried. Next, we're going to talk about exercise in pregnancy. Exercise is extremely important for all of us. In pregnancy, this is no exception. Ideally, 30 minutes of moderate exercise 5 to 7 days a week would be the amount of exercise that you achieve in pregnancy. There are several benefits to exercise. It helps avoid excessive weight gain. It reduces the risk of muscular pain, reduces the risk of urinary incontinence, reduces the risk of baby being too large at the time of delivery. It reduces the risk of the doctor needing to help deliver with forceps and vacuums. And it reduces the risk of diabetes and high blood pressure in pregnancy. If you're currently not exercising at all, that's okay. Even if you could try to just walk 5 minutes a day as your first goal, that would be largely beneficial to you and your baby. Examples of safe exercise during pregnancy, including walking and swimming. During pregnancy, you should avoid anything with a fall risk. You should avoid getting overheated, and you should avoid intense exercise. If you haven't previously been exercising, then pregnancy is not an ideal time to start to train for a marathon. However, if you already run several miles a day prior to pregnancy, it is considered safe to continue to do so. Again, we just recommend staying very well hydrated, avoid getting overheated, and avoid anything that puts you at risk for falling. One of the most common symptoms of first trimester that is so bothersome to pregnant women is nausea and vomiting. We're going to take the time to talk more about why that is and what things you can do at home to help make this more manageable. Nausea and vomiting in the first trimester is commonly referred to as morning sickness. However, morning sickness can occur at any time during the day or night. About 80 women experience this at some point during their first trimester. It's common to start at about week 5 or 6 and typically improves by week 16 to 18. The reason for this is because the hormones of pregnancy affect your GI tract, which cause the nausea and vomiting. Some women are more sensitive to this than others. There's lots of tips at home you can do to help make this less miserable. One thing that's important is to try to avoid an empty stomach. This is one of the common reasons why it's referred to as morning sickness, because in the morning you wake up and you have an empty stomach, and that makes the nausea and vomiting worse. It's a good idea to keep a little snack at your bedside table at night, even just a couple saltine crackers that you can slowly snack on before you get up for the day, right when you wake up. Recommend small, frequent meals. So you might not be able to eat the three traditional meals like you were prior to pregnancy. It's okay to just snack throughout the day on little quantities of food. When you're feeling really sick, it's better to stick to bland foods, avoiding things that are greasy and spicy. Cold, clear fluids can be helpful. Women commonly enjoy things like ginger ale, and lemonade. Smelling lemon, mint, or orange can also be helpful. Ginger-containing products are known to help decrease nausea and vomiting in pregnancies. There's lots of different things that are marketed for morning sickness and pregnancy, and a lot of those are ginger-containing candies. Also, as mentioned before, ginger ale is a good drink that is well tolerated. Try to avoid anything that triggers you. Some women have certain triggers during pregnancy, and it's best to avoid these if you're able to. A common misconception is that marijuana or THC-containing products help nausea in pregnancy, and this has not been shown safe in pregnancy. The long-term use of marijuana and withdrawal of marijuana can actually significantly increase the risk of vomiting. The effects on baby's brain are also unknown. Marijuana and THC are not considered safe in pregnancy, and these substances are not recommended in pregnancy. If you are currently using these substances, we recommend that you talk to your doctor about it. They might be able to come up with ways to help you reduce your use or avoid these things altogether. Talk to your doctor about your nausea and vomiting. Sometimes prescription medications are needed. Dehydration and weight loss from vomiting in pregnancy are serious complications, and they need to be treated and addressed. It's really important that you stay hydrated for your health and to get the appropriate nutrition. These things are also important for your baby. Talk to your doctor about Unisom, which is also called doxalamine, and vitamin B6, which are the common first-line treatment for nausea in pregnancy. These are considered safe and are available over the counter. Next, we're going to discuss things to avoid during pregnancy. Alcohol, tobacco, marijuana, and other recreational drugs are not considered safe in pregnancy. If you are currently using any of these substances, talk to your doctor about it. They can provide information and tools that can help you reduce your use and exposure to these things during pregnancy. It is also recommended to avoid the common pain relief class called NSAIDs. This stands for non-steroidal anti-inflammatory medications and is commonly known as ibuprofen, Aleve, naproxen, Advil. These should be avoided in pregnancy. As we touched on before, unpasteurized drinks and foods should also be avoided. Anything raw or undercooked, including meat and eggs, should also be avoided. Fish high in mercury is also not recommended in pregnancy. Other tips in pregnancy. Caffeine is okay, but should be limited to 200 to 300 milligrams a day. Caffeine in very high doses has been associated with poor outcomes. Lunch meat and hot dogs are okay, but they should really be reheated before you eat them. This is to reduce the risk of listeria and other bacteria that can affect your baby. It is recommended to avoid cat litter if you are pregnant. Avoid anything that comes into contact with cat feces. It is also recommended, especially in the first trimester, to avoid hot tubs, saunas, and in general, becoming overheated. During the first trimester, there's lots of changes happening to your body. It can be overwhelming and it can be hard to know what's normal and what's not normal. Next, we're going to discuss when you should call your doctor's office. When you find out you're pregnant, it's a great time to call and get established with a doctor if you're not already. Your doctor's office might not recommend you be seen for a while, and that's okay. But when you find out you're pregnant, it is a good time to call and get that scheduled. If you have any questions or concerns about your health, you should call your doctor's office. Some things that would be considered abnormal or potentially abnormal that you would want to discuss with your healthcare provider include the following: vaginal bleeding, abnormal vaginal discharge, cramping, fever, significant pain. If you're vomiting so much you're not able to tolerate clears and keep hydrated at home. If you're fainting or passing out. If you develop a sudden onset of shortness of breath, calf or leg pain, or headache or vision changes. We know that during pregnancy, there's so many things that are changing, it can be very overwhelming. We hope that this class was helpful, and we wanted to discuss some common things that are good to know when you're in your first trimester of pregnancy. Now's a great time to ask some questions and to open things up for discussion. Don't forget that if you have specific questions about your health, it is always good to talk to your doctor about these things. Thank you for coming.